So I'm Martin Powell, I'm a consultant gynaecologist. I was appointed in 1993, and my real interest has been the management of women with menstrual disorders. These are one-stop clinics, so that when the patient comes to the hospital, they might have an ultrasound scan depending on what their problem is. They might need nothing further than a consultation with me, but if they need to have a hysteroscopy, an examination of the uterine cavity, then they can just have that done in the room next door to me. So in other words, they can have all their treatment, their investigations, their diagnosis, all in one sitting. Whereas traditionally patients would have come to a gynae clinic, gone potentially to day case theatre and had these procedures done. They're now all done in outpatients. There's been a big growth in the last 5 years in what we call ambulatory gynaecology, where patients are avoiding going to theatre and having all of their procedures done in a clinic room, such as ablations, removal of coils, removal of polyps, rather than going to an operating theatre. So that's a big advantage for the patients. What you thought about the pain you experienced today?
To be honest, there was a little bit of pain today, but not enough that you can't sort of cope with. And to be honest, it actually feels better not having had the local anaesthetic.
Most patients are very tolerant of doing that procedure in outpatients. So having a diagnostic hysteroscopy takes less than 3 minutes. It is a very quick procedure, and as most people practice now, we do this vaginoscopically, so the patient doesn't need to have a speculum in the vagina. They simply have the hysteroscope inserted directly into the uterine cavity. We have a very simple rule that we expect less than 5% of patients to require any local anaesthetic at all. We have excellent nursing staff to provide what is called vocal local, so they distract the patient from the procedure. That enables me to carry it out quickly for the patient and relatively painlessly. And could we have done without the nurses, do you think? Could we have done it on our own?
I think you could have, yeah.
So that's very sweet of you to say that.
It's nice to have the nurses there though,
yes.
Because they kind of sort of break the atmosphere, sort of jolly you along a bit. And, and it's nice just to have someone there that you can just sort of ask an awkward question to or something.
Yes, we think it's helpful for our patients to have nurses there.